Hello guys, vanakkam and welcome to Meteor Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. Today we are going to discuss very important golden point which is related to pediatrics. All the rationals and the vital key points we are going to discuss in detail. So watch the video till the end. Definitely it will be very much useful for you for the upcoming NORCET examination. Let's begin the session. The first question is, what is the name of the image shown here? See the image very clearly. This is the image of a neonate. Here you can see the discoloration of the skin. The half of the skin it will be in pale color and half of the skin it is in red color. The redness is because of erythema. If this kind of discoloration is present, this sign is called as what? And here the correct answer is Harlequin color change. It is also called as Harlequin sign. Okay, so here what is happening, as I mentioned already, half of the body is pale and half of the body is red, otherwise erythema is present. For a healthy babies also 10% of chances is there for getting this kind of sign. Okay, so in the examination if you are getting this kind of images, you have to go for what? Harlequin color change. Very important question. All the question what today I am going to discuss is already came in the NORCET examination. Okay, previous NORCET examination. Okay, fine. The next question is, identify the name of the image shown below. Look at the image very clearly. Here in this image you can see the growth of a fine, soft, minute hair all over the body of a neonate. Okay, so this condition is called as what? And they have given 4 options, that is normal finding in the term babies, icterus, lanugo, post-term babies. Okay, so 4 options they have given here. And here the right answer is option C, that is lanugo. So why I selected this option? See, lanugo is a soft fine hair covering the fetus. Usually this lanugo is commonly present in the fetus, not in the neonate. Okay, so especially you can see this kind of fine soft hair in the preterm babies, especially in the back. What is the function of this hair? In the fetus, the function of the hair is to protect them and keep them warm during the growth and development in the fetus. And the next vital point is, fetus develop lanugo. When the fetus develop the lanugo? Usually the fetus develop the lanugo between 4th or 5th month of pregnancy. 4th or 5th month of pregnancy. And this lanugo, the fine hair, will shed off automatically around 7th or 8th month of pregnancy. Okay, so what are all the key points we have discussed here? A fine soft hair which is present in the fetus, it is called as lanugo. It is very commonly seen in the preterm babies and the function is to protect and keep them warm, and it is developing, this lanugo is developing at the month of 4th or 5th month of pregnancy, and usually it will shed off during 7th and 8th month of pregnancy. So all these are the key points. Okay, so next move to the another question. Here in this image you can see very clearly what is happening here. See, here you can see the pustules all over the body of the baby. Here I have displayed only the head image. Okay, the same like pustules will be present all over the baby of a neonate. Okay, it is called as neonatal pustular melanosis. Please memorize these kind of terms. Okay, neonatal pustular melanosis. Okay, so in this question what they are asking is, actually it is a negative question. They are asking the false statement about this neonatal pustular melanosis. So let's see the characteristics, exact actual characteristics of neonatal pustular melanosis. What are all the characteristics? See, it is a benign condition. Benign condition means a temporary condition. Okay, so it is a right point. Okay, and it is present during the birth. During the birth of the baby, you can see this kind of neonatal pustular melanosis. This is also a correct word. And the next one is, it is seen mostly in the black neonates. to whom it is very common, black neonates. All these 3 points are the characteristics of the melanosis. Apart from that, one more important point, in neonatal pustular melanosis, the baby will be having neutrophils in the pustules, not the eosinophils. What will be present? Neutrophils will be present, not the eosinophils. So neutrophils are there and usually seen in the black babies and present at the birth, and it is a benign condition. These are all the characteristics of the neonatal pustular melanosis. By keeping all these things in mind, so which is the right answer here? Option D. Okay, that is contain eosinophils is the right answer here, because here they are asking the false statement. So here, which is the false statement which contains eosinophils? Okay, so this is the false statement in this question. That's why we selected option D. And the next one is, what is the formula for uncuffed endotracheal tube size in older children? Very important question, guys. All these questions are already asked in the NORCET examination. Okay, first and second NORCET examination, all these questions are already asked. I have taken this question from there only. Okay, so here what they have asking, here they are asking the formula for uncuffed endotracheal tube. They are asking in millimeter in older children. Okay, so what is the formula to identify the size of the uncuffed endotracheal tube? And here the right answer is age in years divided by 4 plus 4. So this is the formula. Consider the baby age is 4. Okay, so divided by 4 plus 4. So if you are cancelling this, it will be 1. So 1 plus 4 is equal to 5. So 5 is the size of the uncuffed endotracheal tube. Okay, 5 millimeter is the size of the endotracheal tube you supposed to select. Very important question, guys, in the pediatric. Okay, and the next one is baby weight. The similar question, same like the previous one, but here it is a standardized answers are there. Okay, no need to use the formula here, but in the previous question, in order to find out the size, we use the formula, right? But here in this question, no need for using any formula. It is a standardized memory based question. Okay, let's see what is that. So baby weight is 1.7 kg. Which number endotracheal tube has to be used? The baby is 1.7 kg and which number endotracheal tube should be used? Okay, and here I have selected the correct answer as option B, that is 3 mm. Why I selected this answer? You can see very clearly here. See, there is a standard method for selecting the endotracheal tube. Less than 1 kg, 2.5 millimeter. Okay, this millimeter is the internal diameter of the endotracheal tube. This internal diameter, this keyword question is asked in the NORCET examination. Okay, so internal diameter means, for example, you take this is as a, consider this as a endotracheal tube, means the internal diameter they are asking. Okay, so for the baby less than 1 kg, the internal diameter of the endotracheal tube should be 2.5 millimeter. For the baby between 1 to 2 kg, the internal diameter should be 3 millimeter. For the baby between 1 to 3 kg, the internal diameter should be 3.5 millimeter. And for the baby with 3 to 4 kg, the internal diameter should be 4 millimeter. How to remember this? You can see here, it is starting from less than 1 kg and the maximum kg is 4. Please remember this one. And the size of the tube, it is starting from 2.5 and it is increasing to 3, increasing to 3.5 and increasing to 4. Every 0.5 is increasing. Okay, so 2.5, 3, 3.5, 4. Okay, so this is also ending in 4, this is also ending in 4. Like that you have to remember. Anyhow, you supposed to remember this one. Okay, because it is a important question. And the next one is, what is the gene mutation seen in the image given below? Okay, this question is asking about the gene mutation. Before discussing about the gene mutation, you should know what is happening to this neonate. See, here you can see the baby is totally having anasarca. Okay, anasarca is present. So this kind of disease condition is called as what? Harlequin. It is also called as ichthyosis vulgaris. Ichthyosis vulgaris. Okay, Harlequin or ichthyosis vulgaris. It is a hereditary disease where the gene is affected. Which gene is affected? And here the right answer is option C, that is ABCA12 gene is affected. This question is also asked in the NORCET examination. ABCA12 gene is affected. Please keep this in mind. Okay, fine. Let's move on to the next question. Identify the disorder shown in the image. So this is the question, and they will be giving the images like this. You can see here, this is the back of the baby. It is from the neck to the gluteal region or till the buttocks. You can see the dark discoloration all around the back as well as in the buttocks. So what kind of problem the baby is suffering from? And this kind of spots is called as what? Mongolian spots. What is that? Mongolian spots. So the explanation is here. These are all the golden points. Please remember everything. It is a Mongolian spot commonly seen in the lumbosacral region. Where? Lumbosacral region, especially in the buttocks and back. Okay. They usually disappears in 1 year of life. The Mongolian spot, usually it will automatically disappear within 1 year of life. It is also known as congenital dermal melanocytes. The other names are important, guys. Congenital dermal melanocytes. Excess secretion of melanocytes pigments are here. That's why it is called as what? Congenital dermal melanocytes. Okay, so these are all the key points. It is called as Mongolian spot, usually seen in the buttocks as well as in the lumbosacral region, and disappear automatically in 1 year, and it is also called as congenital dermal melanocytes. Okay, and the next one is, which congenital heart disease is associated with the maximum chances of reversal of the shunt? Reversal of the shunt. Okay, fine. And here they have given 4 options, that is transposition of great arteries, atrial septal defect, ventricular septal defect, patent ductus arteriosus. Okay, and you should understand the question here. They are asking the congenital heart disease. Everything is a congenital heart disease. The congenital heart disease, it is divided into cyanotic and acyanotic, left to right shunt, right to left shunt. Okay, so all those things we are not going to discuss here. See, they have given 4 options, that is transposition of great arteries, atrial septal defect, ventricular septal defect, patent ductus arteriosus. Among these 4, which one is having the maximum chances of reversal of the shunt? Reversal of the shunt. And here I have given the right answer, option D, that is patent ductus arteriosus. Why I have selected patent ductus arteriosus? What is patent ductus arteriosus? Consider this is the heart. Okay, this is right atrium and this is right ventricles, and this one is left atrium and this is left ventricle. Okay, and here you can see, just for an example I am drawing here. Okay, this is the pulmonary artery and this is the aorta. Okay, and there is a way in between the pulmonary artery and the aorta. Okay, so this is called as what? Patent ductus arteriosus. Usually in patent ductus arteriosus, what is happening? Left to right shunt will be there, because left side having more pressure when compared to right side, so left to right shunt will be there. Underline the word left to right shunt in the patent ductus arteriosus. But here in the question they are telling that reversal of the shunt, this left to right shunt is going to reverse from right to left. How it is going to happen? See, here I have given the explanation. Before that, with the diagram, let's see. Because of continuous flow of the blood from the aorta to the pulmonary artery, there is a opening here. So continuous flow of blood from the aorta to the pulmonary artery. So what will happen, you know, the pulmonary walls will get atresia. Okay, and also stenosed. Okay, so at last what will happen? The pressure here is going to be increased. So automatically the reversal of the shunt is going to take place. Because of the increase of pressure in the pulmonary artery, the pressure increased will cause reversing of the shunt. That is movement of blood from the pulmonary artery to the aorta. Previously how it was there, from left to right the shunt was there, but now because of increased pressure in the pulmonary artery, the shunt is changed from right to left. Okay, so this is called as what? Reversal of the shunt. This question is also asked in the NORCET examination. Okay, fine. And one more important golden point I have mentioned here, that is the second point. Usually this kind of opening, that is the opening between the pulmonary artery and the aorta, it is very common and during the fetal period of time, and this condition is called as ductus arteriosus. This is the normal condition. It is a normal condition, but after the delivery of the baby, this opening has to be closed. Okay, but if it is not closing, that condition is called as PDA, patent ductus arteriosus. Okay, fine. The next one is, which drug is used to keep the patent ductus arteriosus open? Open. This is the keyword. Patent ductus arteriosus open. So, what drug we can administer? And they have given 4 options: alprostadiol, ibuprofen, paracetamol, indomethacin. And here the right answer is option A, alprostadiol. Alprostadiol is the drug of choice to keep the patent ductus arteriosus open. Alprostadiol. Okay, so this is the drug which is used to keep the patent ductus arteriosus open. And what is the drug to keep the PDA closed? The first preference we are supposed to give for what? Ibuprofen, and second preference indomethacin, and third preference is paracetamol. Ibuprofen, indomethacin, paracetamol. These are all the drug which is used to close the patent ductus arteriosus, whereas to open the patent ductus arteriosus, alprostadiol, this drug is commonly used. Please make a note of it. Complementary feeding starts at. You may think that it is very simple question. Yes, obviously it is a very simple question. All know the answer, that is in 6th month the complementary feeding, okay, has to be started to the babies. It is also called as weaning. So the golden point which is related to the complementary feeding is, the first point is it has to be started 6th month. And other important point which is related to the feeding are, in normal vaginal delivery, this question recently asked in the examination, normal vaginal delivery, within how many hours the breastfeeding has to be started? And here the right answer is as soon as possible, whatever the earlier time they have given in the option. For example, if they are mentioning 30 minutes, 45 minutes, 1 hour, 1 hour or 2 hours. So these are all the option is there, means for a normal vaginal bleeding, as soon as possible the breastfeeding has to be started. So you have to go to the very short duration, that is 30 minutes. In case of lower section cesarean section, lower segment cesarean section, LSCS, for this type of delivery the breastfeeding has to be started within 4 hours. Within how many hours? 4 hours, because the mother will be in the anesthetic effect. Okay, within 4 hours the breastfeeding has to be started. And another golden points are hormone responsible for milk secretion and hormone responsible for milk ejection. See, the hormone responsible for milk secretion is prolactin, and hormone responsible for milk ejection is oxytocin. Okay, and the next one is, a child is reported in the emergency with acute bronchospasm and has a history of bee sting. What is the most preferred route of adrenaline administration? So here a baby admitted in the emergency and having the problem of acute bronchospasm, breathing difficulty is present because of bronchospasm. And why it happens? It is happened because of bee sting. And what is the treatment for this? Obviously we need to give epinephrine, adrenaline. So how we are going to administer? We are going to administer through intramuscular is the right answer. That is, answer is option B. Intramuscular is the right answer. Okay. And one more additional key point I would like to add here. That is, drugs can be given through intratracheal. Intratracheal. And for this you supposed to remember as simple mnemonic, that is nasal. 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 Intratracheal, the drugs can be administered through intratracheal can be remembered by means of using a mnemonic called as nasal. N stands for naloxone, A stands for adrenaline, S stands for surfactant, another A stands for atropine, and L stands for lignocaine. So nasal is completed. So these are all the drugs can be administered through the intratracheal. You may ask one question. So here also adrenaline is there. So we can administer through the intratracheal. So why we are going for intramuscular? The first preference what we supposed to give for this bee sting acute bronchospasm is intramuscular. Okay, so that's why we have gone to the intramuscular option here. Okay, the next one is, what is the chest compression and ventilation ratio in neonatal resuscitation? Here they are mentioning about the neonate. They are not asking about the infant, children's or adult. They are going to the neonate. Okay, so neonate, what is the chest compression and breathing respiration, bag mask wall ventilation. Okay, so here the right answer is option A, that is 3:1. 3 chest compression and 1 bag mask ventilation. 3 chest compression and 1 bag mask ventilation. This is the right answer. Okay, and additional points related to this are, there are 2 types of chest compression, that is finger method and thumb method. Among these 2, which is more effective, finger method or thumb method? And the right answer here is thumb method is more effective when compared to finger method. Please make a note of it. This is very important key point. And next one is, when we need to start the bag mask ventilation, when we need to start the chest compression with bag mask ventilation. If the baby heart rate is less than 100, then you can go for bag mask ventilation. Only bag mask ventilation is more than enough if the baby heart rate is less than 100. If the baby's heart rate is only less than 60, then you supposed to go for what? Chest compression as well as the bag mask ventilation. Chest compression and bag mask ventilation. Okay, so these are all the key points related to this. So same like this, we will be adding more and more important videos which is related to upcoming NORCET examination. Please subscribe our channel and support us. And if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Thank you very much, guys.